Hello, my name is Ashra Khanom. I am a research fellow from Swansea University. I am pleased to have this opportunity to present the HERE study, the health experiences of asylum seekers and refugees, findings and recommendations from a survey across Wales. I am presenting this study on behalf of the HERE team. Firstly, I will present the context and background to the study, and then present the findings and recommendations. International conflict and human rights abuses have contributed to the rise in people seeking sanctuary throughout the world and Europe. A refugee is described as someone who has been recognised under the 1951 UN Refugee Convention as someone who is outside the country of his or her nationality and is unable to, or owing to such fear, is unwilling to avail himself or herself to the protection of that country. In contrast, an asylum seeker is someone who is seeking international protection but whose request for sanctuary has not yet been determined by the country in which they are seeking asylum. Wales has a long history of welcoming those fleeing persecution or war and is working towards becoming the world's first nation of sanctuary. People seeking sanctuary have been dispersed to Wales from other parts of the United Kingdom since 2001. However, numbers can fluctuate in response to conflict and government policy. Home Office figures indicate that currently around 2,300 asylum seekers have been dispersed by the National Asylum Support Service to Wales. According to the Welsh Refugee Council, there are just over 10,000 refugees settled in Wales. Refugees and asylum seekers make up less than 0.5% of the Welsh population. What we do know from anecdotal evidence is that many seeking sanctuary have unmet health needs and experience difficulties in accessing services. Within this context, Public Health Wales commissioned the study to investigate the health, well-being and healthcare experiences of adult sanctuary seekers in Wales, including views of recipients and providers, and to also establish what helped or hindered healthcare access and experiences of sanctuary seekers. Understandably, this is a hard-to-reach population, so we used novel methods of public involvement to overcome these challenges. We aligned our approach to all 6 public involvement standards and collaborated with third sector organisations, the asylum seeking and refugee community, and NHS asylum support services, who were all included as valued members of our research team. We recruited and trained a team of 8 volunteer peer researchers from the sanctuary seeking community to collect survey data over 3 months. The survey was translated into 6 languages. Of the 210 survey respondents, 47% were asylum seekers, 47% were refugees, 6% were refused asylum seekers, and 9.5% did not respond to this question. 79% of respondents said they had attended initial health assessment in Wales following dispersal. Reassuringly, 94% reported that they were currently registered with a general practitioner, but only 36% found appointments easy or very easy to make. Awareness of other services was mixed. Best known was the 999 ambulance service, of which 77% of respondents reported that they knew how to access it. To improve the ability of sanctuary seekers to access health and wellbeing services, we recommend that interpretation and translation services are provided at all levels of healthcare, that people seeking sanctuary are provided with introductory information about their rights and entitlements to NHS services, and the NHS continues to work with third sector organisations, asylum seeking nursing and designated health visiting services to maximise support for those seeking sanctuary. Thank you for listening. If you have any questions or comments on this presentation, please add them as a comment below the video. For more information, please click on the available link here.